Today's okay, so today's topic is not geology, it's disease detectives, and rocks and minerals, but I'll start with disease detectives. Okay, so this is an event in both Division B and Division C, and it focuses on the study of diseases and how they spread, which is also called epidemiology. So usually the first half of the test is terminology and graphs, and the second half is calculations and case studies. Okay, so like the first part includes background and surveillance, which is like the terms and processes. And then there's also an outbreak investigation, which you need to know the steps of outbreak investigation and case definition. So I'll talk about this later. And then there's also patterns, control, and prevention of disease, which includes calculations mostly. A good strategy, as with like almost all partner events, is to have one person start from the front and the other from the back. So like whoever's stronger with like terminology and memorization should do the first half, and then the other person should do the calculations. Event rules. Okay, so the time is 50 minutes. So you get 50 minutes to do the entire test. There's usually around 60 to 80 questions, but it depends on the test. So I think it can be anywhere from like 40 to like 100 questions. You can have up to 2 people. You don't have to, but it's recommended. And you're actually allowed to have a cheat sheet. So it's just like a piece of printer paper that's double-sided. Like you just type it out and print it. You aren't allowed to have annotations or labels though. And you're also allowed to have a calculator, but it's only allowed to be scientific. So like no programming or graphing calculators. So here are a lot of important terms. So a cluster is a lot of cases of a certain disease happening close in space or time. It does not matter if the number of cases is more or less than the expected number. An endemic disease is a constant presence of an agent or health condition within a given geographic area or population. So for example, the flu, since it will probably never go away since it's changing all the time. So it's an endemic disease. An epidemic is a disease spanning a large area. So like, for example, COVID, like it started as an epidemic in just China. So it's like in one country or a large area. Etiology is the study of the cause of a disease. It's not the same as epidemiology, but it's part of it because study of diseases and how they spread includes like how a disease starts. A fomite is an object that transmits an infectious agent from person to person. Like, for example, lice. So lice is transmitted by like from infected people to another infected person through like indirect contact. So like lice would be the agent, which is a living or non-living thing that causes the disease. But the comb, it doesn't directly cause the disease, but it carries the lice that does cause the disease, and so it's the fomite, right? So an iatrogenic disease is an illness that is caused by medication or physician. So for example, if you were infected because a doctor didn't wash their hands, so it's like caused by medical unprofessionalism. The incubation period is the time between when a person comes into contact with the pathogen and when they first show symptoms or signs. So it's like the time between exposure and when you find out that you have disease by symptoms. An index case is the first patient in an epidemiological study, and this person is also known as patient zero. Morbidity is the rate of disease in a population, and mortality is the rate of death in a population. An outbreak is more cases of a particular disease than expected over a particular period of time. So like in an outbreak, you have to have more cases than expected. But in a cluster, like the first term over here, it's just a lot of cases happening. But it doesn't matter if it's more or less than expected. So a pandemic is an epidemic occurring over several countries or continents and affecting a large proportion of the population. So like once again, COVID, it started as an epidemic originating from China, but then it spread throughout the entire world and became a pandemic. Plague is a specific type of disease. It's caused by a bacteria called Yersinia pestis. It's a serious, potentially life-threatening infectious disease that is usually transmitted to humans by the bites of infected rodent fleas. There's three major forms of this disease. The first is bubonic. It's like the plague that happened in like the 15th century that killed a third of Europe. It's probably the most infamous. It basically causes like a lot of welts on the skin. There's also a septicemic variation, which is where the bacteria enters through the bloodstream and affects the circulatory system, and pneumonic, or affects like the lungs and the rest of the respiratory system. Risk is the probability that an individual will be affected by or die from an illness or injury within a stated time or age span. So you calculate this, and then you calculate this with like a certain formula that I will show you later. But it's basically like how likely you are to get a disease based on what you did. Surveillance is the collection, analysis, and interpretation of health data. It's used to gain knowledge of the patterns of health problems in the community in order to help with their prevention and control. So there's two types, but the first is active surveillance, where you're contacting healthcare providers to seek info about health. And then there's passive surveillance, which is receiving reports from healthcare providers. So active is where you're like actively looking for information, and passive is where like you're just receiving reports. A vector is an animal that transmits disease, but it's not the cause of the disease itself. For example, like malaria. A mosquito is a vector for malaria, but it doesn't cause malaria directly. Like it's actually caused by like a protist microscopic thing, but mosquito just carries it from it just carries it to a person to infect them. A zoonotic disease is an infectious disease that is transmissible from animals to humans. So hence the name zoo. Symptomatic is where like a person or patient is showing symptoms or signs of injury. And then asymptomatic is not showing signs or symptoms. But just because like a person doesn't have symptoms doesn't mean that they aren't a carrier of the disease. Wait, sorry. Okay, so here are the steps of outbreak investigation. So first, you have to prepare for field work, like preparation, I guess. The second, establish the existence of an outbreak. So gather information about this outbreak, consider the severity, the potential for spread, the public concern, and availability of resources. And then verify the diagnosis to verify it. Construct a working case definition. I'll talk about how to write a case definition later. And then you have to find cases systematically and record information. Then after collecting the data, you have to describe and orient the data using descriptive epidemiology. So then you develop hypotheses, because develop a hypothesis about how the disease started and how it's spreading, and then evaluate this hypothesis with analytical studies. And then if it's wrong, you can refine it if necessary. Then compare and reconcile with laboratory and/or environmental studies, implement control and prevention measures, and initiate or maintain surveillance. Basically, like you have to keep track of how your prevention measures are, like how effective they are. And then lastly, communicate findings. So here are some types of studies. There's two types that I kind of talked about earlier, analytical and descriptive. So analytical is like tells why and how people have a disease. There's two types of analytical studies. Cohort studies, it's where you follow a group of you gather a group of people with something in common, and you either follow them to see the outcome, which is prospective, or use like data from them to determine the exposure, which is retrospective. So benefits are like, it's good for rare exposures, but it's also expensive, and it can be retrospective or prospective, meaning looking into the past or the future. Case control studies they're cheap and not time consuming, but they are subject to bias. And they're only retrospective. So they basically compare people with a disease to people without a disease. So like they compare what the infected people did and what the non-infected people did not do to try to determine how the infected people were infected. But it's subject to bias because people can remember things wrong. Okay, so then there are descriptive studies. They tell who has a disease, what it is, when it was identified, and where outbreak is. So there's one main type, which is cross-sectional. It's also called a prevalence study. It's a lot cheaper and easier to like implement than case control and cohort studies. However, it's not good for rare diseases, and it can only confirm a hypothesis. Like it cannot confirm a hypothesis about the cause of a disease, but it can be used to form one. It looks at data from one point in time only, so it's neither retrospective or prospective. So this basically estimates the frequency of a health condition at a certain point in time and can be conducted with a survey. So basically you need to find out, like in a large population, how many people have the disease. So like if you only find out who has the disease, but not what they did to get the disease, then you can't confirm a hypothesis, right? So you can only form one. Like after getting data from this prevalence study, you can calculate the prevalence rate, which is the number of people with the health condition over the total population that you surveyed. So whereas analytical studies tell why and how, descriptive studies tell who, what, when, and where. Okay, writing a case definition. So writing a case definition is like a pretty big part of the test. So in this case definition, you will include the time the symptoms will start, include the place, include person details like common characteristics or possible other exposures or risk factors, and include the symptoms. And for confirmed cases, there should be lab confirmation. So here I have an example problem. It was from 2022, the division B. So the problem says, your research has shown that most patients with Piacenza reported that they had visited Piper's Peaches in the past 2 weeks. The patients are mostly between the ages of 50 to 75. The report suggests that there may be a correlation between eating the peach pie and transmission of the virus. Symptoms included nausea, abrupt fever, and maculopapular rash. The report also noted that laboratory testing showed that the Piacenza virus could be found in the bloodstream and feces of cases. Okay, so there's also the answer down here, but to write this case definition, you basically just need to include all of these things and like form it into a coherent paragraph. So first, include the time the symptoms will start. In the problem is said that they visited Piper's Peaches in the past 2 weeks. So you would include that, the past 2 weeks. Include the place. The problem said that most patients with this disease had visited Piper's Peaches. So Piper's Peaches would be the place. Include person details like common characteristics. The problem notes that the patients are mostly between the ages of 50 to 75. And you can assume that because they're between the ages of 50 to 75, that might include their risk of developing the disease. So you would include that in your case definition. And they also said that there may be a correlation between eating the peach pie and transmission of the virus. So you would also include that as possible exposures or risk factors. And then second to lastly, include symptoms. So here, symptoms included nausea, abrupt fever, and rash. So you would write that in the case definition somewhere. And for confirmed cases, there should be lab confirmation. So this is a confirmed case. So because it says that laboratory testing showed that the P. virus could be found in the bloodstream and feces of cases. So you would write that here as detection in blood or feces as log confirmation. Okay, so here are some formulas. So first I'll explain the chart on the right. It's like a chart of exposed and unexposed people. So for example, exposed and case so you have exposed, which is people that were exposed to the disease, and unexposed, which is people that weren't. Case is the people who actually developed the disease, and control is people who did not. So this is sort of like a case control study. So you have letters to represent each of these squares. So like, for example, A would be exposed people who developed the disease. B would be exposed people who did not develop the disease or medical condition. C would be unexposed people who were a case, and D were unexposed people who did not develop the disease. Okay, so formulas. There's one thing called absolute risk or attack rate. So it's basically how many people get a condition compared to the total amount of people in that sample. Basically, either the rate of exposed people who did get sick or unexposed people who got sick. So like A or C over the total. So the rate of exposed people who got sick. So A is the exposed people who got sick, and A plus B is the total number of exposed people. So A divided by A plus B. And then unexposed people who got sick is C, and then the total is C plus D. So C divided by C plus D. There's also a risk ratio or relative risk, and it's not the same thing as just risk. So it's the ratio of risk between exposed and unexposed. It's used in cohort studies, which is a type of analytical study. If it's above 1, then there's a positive correlation between exposure and condition, which basically suggests that the exposure causes the condition. And if it is 1, then there is no relationship. If it's less than 1, there is a negative correlation, which means that the exposure prevents the condition. And then you calculate it by here. So you have the risk of exposed people divided by the risk of unexposed people. Yeah, and remember, you don't have to memorize all of these formulas because you have a cheat sheet. So you can just write it in the cheat sheet, but you still need to know what these letters represent. Okay, still more formulas. So this is actually basically the same table, except just expanded a little bit. So the odds ratio is the ratio between someone who is sick and was exposed to someone who was sick and wasn't exposed. It's used in case control studies instead of risk ratio. So on the previous slide, I mentioned that risk ratio was used in cohort studies, but odds ratio is used in case control studies. If you calculate the odds ratio and it's above 1, then that means there's a positive link, which once again suggests that the exposure causes the condition. If it is 1, then there is no correlation, and if it's less than 1, negatively linked. So you calculate this with A divided by C, and then all of that divided by B divided by D. Or you can simplify this formula into AD divided by BC. Then you have the positive predictive value, which is true positives over total positives, which is total positives that you detected, which is true positives plus all the false positives. Sensitivity is the ability of a test to correctly identify patients with the disease. So ability of a test to identify positives. So which is true positives divided by true positives divided by true positives plus false negatives. Specificity is the ability of a test to correctly identify patients without a disease. It's basically the opposite of sensitivity. So it's true negatives divided by true negatives plus false positives. Attributable proportion is risk ratio minus 1 divided by risk ratio. It's the portion of cases that can be attributed to the exposure. So like, remember in risk ratio, here on the previous slide. Oh, sorry. So risk ratio on the previous slide, you calculate it to see the ratio of risk between exposed and unexposed, but it doesn't actually tell you how many cases were caused because the patient was exposed. So attributable proportion does tell you how many cases are actually caused by the exposure. Okay, so here are some helpful links. Okay, so the first one is the official CIOLI website. It basically gives you some like important general information about this event. And there's like an SO Inc. Site. Like there's two links, one for division B and one for division C. And then there's also the CDC, because this event is mostly about epidemiology, which is like diseases, and the CDC is the Center for Disease Control. So like, yeah, it would help you because it does give you some information about like general epidemiological practices. And I think it also gives you some like practice cases that you can use to write case definitions. Okay, so here we have some example questions. So the one on the left was from Bird SO. It was like, these are both from 2022. So this is like the first few questions, and it's just asking about terminology. Like these terms I did, sorry. These terms I didn't define in this lesson, like, and you probably don't need to know a lot of them, but like, this is basically the format. Like they give you a bunch of terms and you have to match them to the definitions. And I also have like an actual practice test. I don't know if, yeah, okay. Okay. So this is an actual like test. So here you have some like terminology things. You have to know the difference between some vocabulary and then like answer questions about them. So here you have an outbreak investigation, which is like a pretty important part, I guess, where it basically gives you like a really long paragraph driving a disease or outbreak investigation that either happened or they just made up. Then you have to answer some like questions after you read it. Like, for example, you need to identify what kind of study it is. So like just scanning through it, it tells you that like it followed two schools, one like from two schools, one from Maricopa and one from Pima counties. So it's a cohort study because you follow these two schools to see how many people in them like developed COVID. Okay, well, you can read this later if you took a screenshot or something, but like you just answered the questions. So you identify the study, you have some basic like math questions. Okay, and then you have the table that I showed you earlier. Like this, like no mask requirement basically means exposed. This is unexposed, and then case or no case. Like they use different words, but it means the same thing. They'll ask you to do some calculations, like here they ask for the odds ratio since it's a cohort study, right? And then interpret it. So here they calculated it to be like 3. And because it's 3, which is greater than 1, it means that there's a positive link. So like it means that the exposure, which was having no mask requirement, contributed to like the number of cases, which you can verify with common sense. Like, yeah. And then they have another case here. Like, whereas this one was really long and specific. This one is kind of like a lot shorter and like, I don't think it's real. Okay. Okay, well, for the last 10 minutes, we are going to do a Kahoot. Andrew, did you say you were going to share that?
Oh, yep. Give me a sec.
Okay,
I'm making my way to the Kahoot. Disease detectives. Give me a sec. And here we are.
is everyone who wants to join the Kahoot?
I think so.
Okay, then I guess you could start. Yeah, so this Kahoot might be kind of like difficult, but I guess you can use the lecture notes like in the slides to help. It's 25 questions long. So first, what is a fomite? Yeah. It's a non-living thing that carries an infectious agent. So like it doesn't cause the disease itself, but it just carries like the thing that does cause the disease to the person to be infected. Okay, we can go to the next question. Double points. Which of the following does not describe an advantage of cohort studies? Yeah, it's less expensive compared to case control studies. This one you kind of just have to memorize or like look for in the notes, I guess. Oh, by the way, there's like a 10-second time limit, so like if you don't know, just guess and hurry up.
It's fast.
There's 25 questions. Okay. What is etiology? Etiology is the study of the cause of a disease. Yeah, it's not the same as the study of diseases and how they spread. That's epidemiology. Okay. Which of the following is not an analytical study? Yeah, so cross-sectional study is not an analytical study. It's also called a prevalence study. It's descriptive, and it basically only tells you who has the disease and not why or how. Yeah. What is an endemic disease? Yeah, it's a disease that is constantly present. Yeah. I'm not going to tell you what the other ones mean because they will appear in later questions. Double points. Which of the following is not a step of outbreak investigation? It's none of the above. All of them are steps. Good job. Which of the following cannot be used to confirm a hypothesis about the cause of a disease? And yeah, you can use past cheat sheets if you want, I guess. You just have to be quick about it. Yeah. Cross-sectional study, because it's the only one out of these 4 choices that's a descriptive study. So it can't confirm a hypothesis. Yeah. Three points, yay. Read carefully. Yeah, the answers literally told you it was that one. What is a zoonotic disease? Yeah. Okay, a lot of you got it right, so good job. What is the difference between mortality and morbidity? Yeah. Mortality is the rate of death and morbidity is the rate of infection. Double points. What is an iatrogenic disease? Yeah, it's a disease caused by healthcare professionals who fail to use clean technique. If an outbreak of the plague were to occur, which of the following methods would be most effective to prevent the spread? Yeah, so the most effective would be to like cut off the plague at its source. I guess like quarantine wouldn't be as effective because it would take a long time to work like efficiently. Yeah. Which of the following is the first step of outbreak investigation? Yeah, so the first step is preparing for field work because you have to prepare. Okay, good job. A cluster is more cases of a disease than expected over a period of time. True or false? Yeah, it's false. So for a cluster, it doesn't matter if it's more or less than the expected number of cases, but for an outbreak, it does. Yeah. Lyme disease is caused by Borrelia bacteria. When ticks feed on the mice that are infected with disease, and identify agent. Yeah, so this problem gave you a lot of information that you probably don't need. So the agent is the living or non-living thing that causes disease. And it states that the disease is caused by Borrelia bacteria, so that would be the agent. Ticks would be ticks would not be the thing that directly causes the disease. So yeah. Which of the following are required in a case definition? Yeah, both of these are required. And many other things. What is a cluster? Yeah, it's a group of cases concentrated in time and place. It's like a group of diseases. No. What is the time between exposure and symptoms called? Oh, it's called the incubation period. Yeah. The index case is also called patient zero. If the odds ratio is above 1. Yeah, then there's a positive correlation, which means that the exposure causes the condition. Yeah, you can. If the odds ratio is below 1. Yeah, then it's like the opposite. There is negative correlation. In case control studies, you calculate odds ratio. Which of the following is not a requirement for case definitions? None of the above. All of these are required. In cohort studies, you calculate risk ratio. Yeah. Okay, last question. What is epidemiology? It's the study of diseases and how they spread. The study of the cause of a disease is etiology. think that was the last question. And third, question mark. And second, hi. And then first, congrats to Jerry Huang. Good job, guys. Okay. I think we can do a break now. How long should it be?
10 minutes is playing.
Okay. See you in 10 minutes.
Hi. Hi.
Hello.